to
So let's talk about
accessing the
Halton
service.
Halton.ca, because a lot of our audience are a mature audience that doesn't really navigate a lot of websites. So once you get to Halton.ca, where do you go to get that information?
So, once you're at Halton.ca, and you're going to find that there's on our current website, there's a section called for residents, and within that there's a public health section, and within that there's a mental health section. And so most of this information is housed within the public health part of services, and that makes sense because this is really about public health. The public health element of what happens at the region is broad-based. It's intended to provide community level service, and it's not the 911 kind of issue. So if you've got somebody who's truly in distress, call 911. That's the right place to go for it, and people shouldn't feel that it's the wrong place. They shouldn't feel, gee, this is a mental health issue. Why would I call the emergency department? Why would I go to the hospital? But if you've got serious mental health concerns that are going on in your household or with a friend, that can be the right place to go. And after they've looked at the individual and they've considered the issue, yes, there's going to be other supports that are going to be needed. Just as if you walk into the emergency department, you've got a broken bone, sure, they'll set it, but there's going to have to be remedial work done afterwards. You're going to have to go and probably do some kind of long-term exercises to get your arm back in shape or get your leg back in shape, right? So similarly for mental health, after an initial crisis is passed, there needs to be supports, and those medical professionals are the ones that can link a person to those supports.